And I guess there is that thing where actually you never think it can be you, but actually the one thing I always say now is cancer doesn't discriminate. It can be any of us, and 1 in 2 people will get cancer.
Welcome to the Lifestyle Prescription on Pharmacy Planet. I'm Rena Annobil. Thank you so much for joining me. So, in today's episode, we are going to talk about a disease which surprisingly has a lot of stigmas around it, despite the fact that sadly it's becoming more and more prevalent in adults over 50 worldwide, actually. I'm talking about bowel cancer. It is the fourth most common cancer in the UK at the moment. And symptoms can often be embarrassing for people to talk about, which means that they're often ignored or sometimes missed. Now, my guest today is someone who has experienced this illness from both sides of the consulting desk. Dr. Anisha Patel is somebody who is an educator. She's also, as well as being a GP, an educator. She is an author and she is a cancer survivor who shares her journey on a platform, a powerful platform actually, called Doctors Get Cancer Too. And she's in the studio with me right now. Thank you so much for joining me.
Thank you for having me.
Got lots to talk about. So, your experience of bowel cancer, obviously, your wonderful book, which is super helpful for people. This whole stigma around screening and symptoms and women's bodies. And I know that you are, championing just women talking about their bodies more so that we can actually just get people to delve into things that are wrong with us instead of ignoring it and brushing it under the carpet.
Yeah, 100%. I mean, my sort of specialist interest is women's health and general practice, and that's what I lead for, but also the cancer side as well. But I have learned so much actually since the 7 years since my diagnosis about, people's thoughts, their perceptions, and actually the challenges we're facing when it comes to cancers and women's health.
So, with your cancer, obviously you're a doctor. Did you recognize symptoms within yourself straight away?
So I initially started with just feeling tired initially, and I'd become partner at my practice. My children were 5 and 6. I was burning the candle at both ends. When I had some blood tests, but they were all normal, so I was like, okay, I was satisfied. But I was getting a bit more constipated. And I thought, oh, it might be just lifestyle, irritable bowel syndrome, and I'd get a tiny little bit of blood on the tissue because I'd had piles in childbirth. I assumed that was because I was constipated, and it was very intermittent initially. My husband is a bowel cancer specialist. So after a couple of months, I did confide in him to say, I think this is probably, I just want to run this past you. I'm probably going to go to the doctor. He was like, absolutely, go and get it checked. So I did go to the doctor and I was checked. They gave me treatment for constipation and piles, which actually was reasonable. And they said, if it doesn't get better, then come back. And my symptoms were intermittent, but I had a couple of times where I'd had tummy pain. I couldn't really describe why. And when I went on holiday in Italy in the summer, the symptoms got a lot worse. And actually, if you look back at the pictures, I got thinner as the pictures went on. I was unable to run because I think I was becoming anemic. I thought it was the heat. And so when I got back from Italy, I went back to my GP, and 2 weeks later, September 2018, I was told I had cancer. And at that point, it was locally advanced as stage 3 rectal cancer.
Wow, that's really shocking, actually. And the thing is, the symptoms that you described that you were feeling at the beginning, sound very common amongst people. The constipation, feeling tired, and that kind of thing. Even when it comes to women's health, after childbirth, there are certain differences, certain things that happen. That women, I don't know, I just feel like you put it down to, oh, okay, because I've had a baby, now things are different down there, or I get constipation more, or that kind of thing, or I'm, bloated more. So I feel like a lot of people might not take them seriously straight away, those
and
things.
That's the danger. I mean, I think it's sometimes explained away, or you haven't got time, or you just think, oh, it will settle down. But actually, weeks and months sometimes pass before someone then says, actually, I've been suffering with this. And I think for me, I was 39. I had no risk factors for bowel cancer. My husband and I genuinely thought it would be something like inflammatory bowel disease, like Crohn's disease or ulcerative colitis, even though my husband, for a few years prior, said, I am seeing more and more young people with bowel cancer. And I guess there is that thing where actually you never think it can be you, but actually the one thing I always say now is cancer doesn't discriminate. It can be any of us, and 1 in 2 people will get cancer.
Mm. And you said about the symptoms and well, lifestyle really, like, because when a lot of us, when we hear bowel cancer, we think about, and I think it's because of news reports that we've read and stuff, what we know, probably misinformation a lot of the time. Oh, this person has a lot of processed meat, and they don't lead a very healthy lifestyle. These are thoughts that might come into a lot of people's minds. What did you think that as well? And you're saying that you were quite in a healthy space, so
Yeah.
was that even more surprising?
I think that's really true. So 54% of bowel cancers are preventable. And we know that 96% of the population aren't getting enough fibre, yet a third of cases that are preventable are due to lack of fibre. So we're meant to be getting 30 grams of fibre a day. There are other risk factors, like you said, the processed and red meat consumption, being overweight, not exercising, family history. And, I was brought up in a Gujarati household, growing up. We had meat as a treat at the weekend and usually fish.
Same with us, yeah.
We had very much a plant-based diet growing up. My parents own a health food business. We didn't have processed food. And what we do know is that there is this global rise in early onset bowel cancer. So bowel cancer under 50s. And it is growing exponentially. We know that since 1995, there's been a 24% increase in bowel cancer under 50. And this is in 27 out of 50 countries worldwide. And in fact, some of the work that I'm doing at the minute is looking into other risk factors and why there is this global rise. And I'm doing that with funding from the Bowel Fund and Cancer Research UK under the Cancer Grand Challenges. And we've got a team worldwide from Harvard to India to Italy, and we're basically facing a race against time. I'm going to be brutally honest, trying to find the answers and work out who we need to screen earlier, because it is those patients diagnosed younger tend to be diagnosed at a later stage, therefore have more brutal treatment and side effects, die more, and ultimately are presenting as an emergency rather than coming to me at those earlier stages.
Can you share any findings at the moment in terms of the research?
So the research, we know that there is a strain of bacteria called E. colibactin. So we've heard of E. coli. There's a colibactin toxin that's found in the gut of those with bowel cancer at an increased prevalence. So we are doing further studies into this. We are looking at all sorts of things, including environmental aspects, ultra-processed foods. We're looking at early antibiotic use. And I think there is so much that we don't know out there. But what we do know is that it's likely to be multifactorial. It's not just going to be one thing we find.
Right.
There's going to be lots of things that contribute. And we actually think your risk develops in early life. So childhood and maybe the younger adulthood years, we think that actually the precipitant or the thing you're being exposed to is during that period. So it's fascinating work.
It's fascinating, but also it sounds a little bit scary as well. These are shocking figures. And when you're saying, from childhood, things that you are exposed to. So I guess it's there needs to be more research done regarding that.
Absolutely. So we've done 2 years so far. We've got another 3 years. And as things uncover, and we're not the only team doing it, this is a race against time for many teams. There's lots of work being done into early onset bowel cancer. But I just want to say there's also several other cancers that are increasing in the under 50s, including breast cancer, lung cancer, head and neck cancers. So, there is something contributing to all these cancers, and we might just be starting to unlock those things looking at bowel cancer first.
Right. Okay. And I will come on to things to be aware of in terms of our bodies and bowel cancer symptoms and things like that. But I want to talk a little bit about your journey. Right. So obviously you got diagnosed stage 3.
Yeah.
Okay. So that must have been like being on the other side, how was that for you? And did you kind of, I don't know, like, is it really different to be a doctor and be the patient? Like, did you try to kind of, were you at work as part of it? You know what I mean? Like,
Yeah. I think I think it was really a double-edged sword, to be honest. I obviously knew a lot more, and was better informed, and obviously was worried about it, coming back, going into my lungs and liver, all the things. You start sort of thinking about all the complications, and actually it took me back to that time when I was on a bowel cancer ward, like a bowel ward, when I was a junior doctor. And I remember the professor of bowel cancer, colorectal cancer, saying to me, so, if I'd had the stage of cancer that I'd had then 20 years ago, I had a 50% chance of dying. So for me, within 5 years. So for me, I've obviously got all these snippets of information that are sort of darting around my head. My husband's even more informed as a bowel cancer specialist. And I think that was really difficult. But also, on the same token, I also knew what was coming next to a degree. I've obviously never had major surgery, chemotherapy, but I think for me it was a very humbling experience. I understand so much more the patient experience journey, the ripple effect on the family, how hard it is to navigate life after a life-changing illness. And actually, for me, the biggest issue I had with it, and the thing that I had the most therapy for, was the loss of control. I'm meant to be the doctor. I didn't like being wheeled down a corridor. I would get really tearful. I didn't like going under anaesthetic because people were doing things to me. So every time there was a place where I was out of control in a scanner, it was really difficult because I just felt like I didn't belong.
Yeah, but I can understand that
Yeah.
because of what you do. Did anything surprise you about the patient experience?
I think it's how vulnerable you are in that space. And I think I was given, we obviously always talk about options with our patients. It's a two-way process. But I think sometimes my specialists gave me a bit too much. And actually what I really wanted them to do was advocate for me and my best interests and give me the best treatment they knew how to. So I really did leave it to them and my husband to have those discussions, partly because I was in shock. I
Yes.
felt like it was an out-of-body experience. I was just going through the motions. I just had to get through it. Mainly for my children. I was like, I don't want them to have to live through this. This is horrendous. They're 5 and 6. I'm taking away their innocence. And I think for me, I've really struggled with that, which is why I think I've had to I wanted to turn my negative into a positive. I wanted them to see that out of adversity, you can rise and you can do things, and mum is still mum, but she has different challenges, which I'm thankful for. They are very understanding of.
That's really young,
Really
it's
young.
really young. It must have been so challenging to actually just cope with raising your kids and making sure that they were cared for at that time where you were going through the treatment.
It was really difficult, but I had an army behind me, and that's the other thing, I really feel, because when I see patients and they haven't got that army behind you, how much more difficult, lonely and isolating it can be. I mean, I've never felt so lonely. I joke about this. I said, I feel so lonely, and people are like, but there's people around you all the time helping. But I think that actual experience of cancer is so lonely, which is why I wrote my book. But I had, parents-in-law, parents, brothers, everyone and friends every day, leaving food parcels on the doorstep, doing a rota to take my children to things. And I feel sad. Yes, I did miss out on some of their firsts. I didn't get to take them ice skating. I didn't get them to take them to something else, to a theatre play, but someone else did, and I'm grateful they got to do that. And I had to prioritise surviving.
And you're here for them
I'm
now.
here now, and they're like 13 and 14, and they say to me, Mum, cancer's not that bad, is it? You're like on TV, you're writing a book, you're going to this event, oh, you're just recording another podcast, oh, you're the main. And actually, I what I really made clear to them is that I would give all of this back in a heartbeat. Like, I love the work that I'm doing now. It's emotionally exhausting, but it's so rewarding. It's so cathartic as well. This is how I can still be a GP, because I see cancer and I'm trying to exclude cancer every single day. And patients do sometimes come to me because they know I know. I get it.
And also for your children to think that about you shows what strength you have. that you're giving this image to your kids that you're breezing through, right? And obviously you're so passionate about what you're doing as well. So the life after, well, can I just go back to your treatment actually? In terms of treatment, what did that involve? Did you have chemo, and how long did that go on for?
Yeah, so I was really fortunate. Most people with my stage of cancer would have chemoradiotherapy first, but because I was young, they took a calculated punt to just open me up first, and they and see if I needed it, see if it had spread. And actually, they spared me that initial chemoradiotherapy, so I had major surgery removing half of my rectum, which is what stores your poo, and part of my bowel, and I'm now left with a permanent bowel dysfunction. I had a stoma temporarily to allow the bowel to heal. I had more surgery to have that stoma reversed and my bowel replumbed back together, and then I went quite grueling chemotherapy. I mean, it was the pits. I'm going to be honest. And then I was done, and then having scans every 6 months and living from scan to scan for 5 years.
Wow.
And
Okay.
that's hard.
That is, yeah.
You put your whole life on pause. We wanted to move house. We didn't move house. I couldn't get travel insurance initially. I couldn't get other insurance. All the things that we take for granted, actually, they all became difficult. But actually, I was fine with that. I was living, I was surviving. And actually, we used to live from scan to scan, which was difficult. So we'd have 4 months of trying to live our best lives and an urgency to live. And then it would be scan time again, worrying about the scan, worrying about the result, getting the result, processing it, and then back on the same circuit. And that was tiring for my husband and for me. And I think people really underestimate life after cancer because they just go bish bash bosh, you're done, off you pop. You should be bouncing around like you've survived. And yeah, I am. I'm eternally grateful I've survived, but it's come at a cost to my family and to me.
Like people see you bouncing around, you're looking absolutely beautiful. We see you out there spreading really important messages about female health, about cancer awareness, that kind of thing. But in terms of being a bowel cancer survivor, like you told me about your treatment just now, what are those lasting effects for you physically?
So physically, chemotherapy damages the nerves in your hands and feet. So every time I touch cold, or my feet touch cold, I've got like nerve pains, sharp nerve pains, and I don't have as much balance in my feet anymore, so I fall a lot more because it damaged the nerves. I've got this permanent bowel dysfunction, so today I think I've already gone to the toilet. I don't mind sharing. It's like 10:30, 7 times today. And sometimes,
Is that normal for you?
so that can be completely normal. Some days it's more. And I can go and eat out or go, when I'm abroad, it can be really difficult. If I get a stomach bug, I can't actually leave the room, And then we've got all the other effects. So it's impacted my kidneys, so my kidney function isn't as good. I've gone into early menopause, and people who go into menopause surgically or medically often have a menopause that's like a crash menopause with worse symptoms.
Okay.
And so that has been a whole different thing that I had to navigate a lot earlier than some of my compadres. And the mental aspect, I mean, for me, the mental aspect has probably been as big a deal as the physical aspect. I'd never had mental health difficulties till cancer. And actually, it took me a long time to accept that I had PTSD and that I had anxiety. I had a counsellor at my cancer centre run through a charity, which I was very fortunate to have, and she took me through 18 months of counselling, and that's how my Doctors Get Cancer 2 blog started. I cathartically wrote through it. I'd then release it, I'd run away, didn't want to look or engage, and then I'd read it to my therapist, and then I'd process and go on to the next chapter. And for me, that has been therapy in itself, and I've got a toolbox now to manage my physical and emotional well-being. It's not always perfect, but I always say to people, for whatever you live with, mental health-wise, physical illness-wise, you need your own toolbox, and your toolbox is going to be different to my toolbox. I can share some of the things that might be helpful, but you need to try. And with the mental health aspect, that was really difficult, and I think even though I'm better now, there are still times where it rears its head. There are things that are triggering, there are things that take me right back, and I use my tools to try and manage it.
Is there a sense of anxiety that you carry with you afterwards? I have spoken to some cancer survivors, and they do talk about that kind of thing. Or does your toolbox help you to manage that?
There is anxiety that comes with it. Look, you're dealing and you're living with one of the biggest uncertainties you could possibly live with. And that fear of recurrence never goes away for some people. So I'm 5 years out of what we call surveillance, of being heavily monitored. I still have regular colonoscopy checks, but I've got to a place, because of my husband as well, that I know if I've survived 5 years, I think I'm going to be okay. But if I've had one cancer, because of the treatment I had, and by virtue of having one cancer, that puts me at a greater risk of having another cancer. So that never really leaves me. I know that fear will be there, but I try and compartmentalize it. I use my tools, and for me, the urgency is for my kids, and my urgency is to live life.
So, your experience and your knowledge, has this made you kind of reshape the way that you look at your health and well-being? Things like how you move your body and the things that you eat.
Yeah. So as I say, before we were fairly healthy. I was always active. I was always exercising, and I have been since childhood. And movement's medicine for me. I think I'm much more aware of self-care. I think women are awful at self-caring, awful, dreadful. But I have actually learned to be, and I shouldn't say selfish. I've learned that it's a necessity. Self-care isn't an option, and I've really been cautious about implementing that into my life, about trying to reduce stress where we can, about making sure that our diet is really varied. So although I was conscious of this before, because my mum always showed us good eating habits, I'm very conscious now of making sure we hit that 30 grams of fibre. That yes, if my children want a bacon sandwich, I don't have a breakdown about it. I used to, honestly, I used to get palpitations if they wanted to.
Yeah.
But if it's for a treat, because it's your birthday, you knock yourself out, because I don't want to make things forbidden. But I'm very conscious of what we eat. And it's a bit of a joke about the food police in the house and me being like that. But actually, I hope that some of those things they'll take into adulthood. And I think that's really important. So yeah, I am very conscious. I live by the 80-20 rule though, and I wrote in my book as well, if you want to go and have that steak and a bottle of wine on your birthday, you need to do that. We've got to live that balance.
And let's talk about your book now. So, got it here. Everything you hoped you'd never need to know about bowel cancer. A doctor's very personal guide to getting through the shit and beyond. And I've taken a look through your book, and it is the way that you have described this is, it's like it's like a friend.
Yes, that's exactly it. Companion.
Yeah, and I think, and I can imagine that this is the friend that people need when they're going through that experience, if they've been diagnosed with bowel cancer. Because let's face it, Anisha, you know this, and I know this, like in this day and age, like people are Googling symptoms and relying on AI to give them all the information they need. And so the fact that you have turned your pain into purpose and written this is amazing. Like, when did you know that you wanted to write this? And is this what you probably wanted when you were going through this?
So do you know what? Everything that's happened to me, Rena, I'm going to be really honest, has grown organically, and I love that authenticity, and I really wanted to keep that. And so when I blogged my way through it, it was selfishly for me, it was catharsis initially. But then I realised when I was researching and writing and then sharing, people were like, oh wow, thank you for this. And so I continued. And then obviously the great Dame Deborah James did so much to raise awareness of bowel cancer.
She did.
And actually people were wanting to talk about it. So I was actually approached by a publisher, having had people through social media contacted me saying, you should really put this in a book. I was like, oh, yeah, I'm not a writer. But actually I learnt to write through my pain. Like writing, I absolutely adore writing now. And even for non-cancer stuff now, even through my social media, I write about day-to-day things that people can relate to, because it's cathartic for me, but I actually know it holds someone else's hand and that it is relatable and you're not alone. And that was what the book was for. So when the publishers approached me, they said, we would like an A to Z of bowel cancer. And I looked at them thinking, oh, really? And I said, I'll tell you what, I'll write you the first half of the book is the A to Z of bowel cancer, everything you need to know, from the risk factors to treatments to what you need to pack in your hospital bag. But it's also for the carers, for the relatives, for the loved ones. So if you know someone with it's got all the tips for that. And I put in my diary entries to sort of illustrate my thought processes through the time. But the second half of the book, what I said to the publishers was, this is what I want to write about, because you can't find it in the literature in one place about how you navigate mental health, the loss of self-identity, the fertility it takes away, the menopause, the bowel function, the side effects of chemo. How do you get back to work? How do you have those conversations with your employers? If you're from a minority group or from the LGBT group, how do you navigate? What resources are out there? How do we make sure everyone's involved? How do you nudge your relative to go to screening? Because actually, a third of people don't turn up to screening. And I think all of those things were real passionate moments and things that I discovered as I was going along that need to be addressed.
Well, it's a great book. And, it's for everyone actually, because this, in here, you've got stuff like what's normal when it comes to like going to the toilet and that kind of thing, things that you need to be eating. And it's one of those things, bowel cancer, I said in the intro that the symptoms are embarrassing to talk about a lot of the time, which is why a lot of people don't. In terms of symptoms and early detection, like what do you kind of advise to people, and how much do you think that, like, do you think people take it seriously, first of all, what their poo looks like, for example?
So we know that half people don't look before they flush, and I know you don't have to look every time, but if you never look, how will you know when there's blood in the pan? How will you know when it's not normal? And this is my slogan. If you don't check, if you don't know you're normal, how will you know when it's not? And, actually, interestingly, Bowel Cancer UK did a study on the under 50s called the Never Too Young study. 1 in 3 people didn't know blood was a symptom of bowel cancer.
Right.
50% of those diagnosed with bowel cancer young didn't know it could happen to them. And a lot of people don't know all the symptoms of bowel cancer. So the way I ask people to try and remember it, because it is difficult, is by the acronym Bowel. Okay, so B is for blood in your poo or blood in the pan or on the tissue. O is for an obvious change in bowel habits, so that might be constipation, diarrhea, going more frequently, not feeling like you've emptied your bowel properly, a change in shape of the poo. So my poos were like ribbons because the tumour was pressing on it, compressing it, so they're coming out long and thin. W is for weight loss that's unexplained. E is for extreme tiredness, and L is for a lump in your tummy or tummy pain. And when I talk about persistent change in bowel habit, I mean more than 3 weeks. Okay. So yes, if you go away on holiday and you get a stomach bug, you might be up to 7 days. But if you've got symptoms 3 weeks or more, you really need to be going to see the GP. And what I want to reassure listeners is, most of the time it's not bowel cancer, but we can check. We've got simple blood tests, poo tests now, literally dipping a stick in poo, which is the same stick as the bowel cancer screening programme, can tell us so much information whether you need further more tests.
This is really important information, so important. So thank you for sharing that. Do you think that there is still a lot of embarrassment when it comes to going to the doctor, though? Do people think, oh, okay, the doctor's going to have to put their hands up my bum and all this kind of thing? And do they do that? Let's be real here.
Yes, I mean, we as a society are to blame for this, surely. Historically, we know children says bum, fart, poo, wee, and you see parents go, shh, shh. We're hushing our children and telling them that it's dirty, it's naughty, it's embarrassing, you don't talk about stuff like this. So when they get to adulthood, then they're worried that they can't talk about those things openly. And what I really encourage our listeners is that actually have these open conversations with our children, with your nieces, with your nephews, with your grandchildren. Use the right words, use bottom, vulva, vagina, poo, whatever you want. Don't hush it away, because actually that's where the stigma comes from. That's where the embarrassment comes from. And actually this is worse in certain communities. It's not spoken about often in the Asian community, for example. I know that I'm one of the only ones, and thankfully there's more and more people now like me coming out that represent us, because people think, oh, you don't see an Asian person getting bowel cancer. Well, yes, you do. There are lots of us. It's just that we're historically may not have been represented in campaigns, or historically we've not wanted to talk about it because it's not what you do. You don't talk about cancer, you just get on with the treatment. And, even my therapist said to me, she said, Anisha, when I go to the ward, there's people of all backgrounds. But in my room, I only see Caucasian people. And she said she had one Muslim lady come to her and she had to lie to her family where she was going when she was going for therapy. This is still happening.
Yeah.
We're in 2026. Cancer is shit. Why are we still doing that? Why are we still hushing it? And actually, Dame Deborah James, she really opened up that arena for talking about poo. It was the poo cancer, the brown cancer, the one no one ever wants to talk about, but it's the UK's second biggest cancer killer. And in the US, it's now the number one cancer killer in the under 50s. Things have got to change, and that's why we're having this conversation today. So I'm really grateful to have these platforms where people are welcoming these conversations.
Absolutely.
And as I say, the Bristol stool chart, look it up if anyone's see it. Like, people don't know what a normal poo is. So when they come to me, they say, I've got a problem downstairs, and I'm thinking, well, there's 3 holes there. Which one am I going for? Is it the urethra where your urine comes out, your vagina, or your bottom or your anus? And then we get to the bottom of things, sorry, no pun intended, literally. And then we have to move on to, actually, where is the blood coming from? I don't know which hole it's coming from, because they don't check. And that's not their fault. It's the fact that we haven't been taught how to advocate for ourselves. And that's another thing I'm really passionate about, health literacy, because actually that's one of the issues where people don't take up screening, where people don't know symptoms, where people don't understand health and what to look for. And particularly, again, in certain groups where it's worse, that we need to be providing that education.
Absolutely. Now, if there are people who have listened to what you said and they're like, well, I sometimes have this, I'm kind of concerned about things, but I'm really nervous about going for screening. What would you say to them?
So if you have got symptoms, you need to go to see your GP. And I would say to them, write down your list of symptoms, because that can sometimes help. And actually, it's brilliant because it helps you get to the point of what you want to say. Tell them what you're worried about, tell them your concerns, and tell them what you hope for. Tell the doctor you're embarrassed. Actually, we will go above and beyond to try and make things more reassuring. If you know you might be having an intimate examination, wear a skirt if you're a lady, for example, so you don't have to take everything off. And actually be inquisitive, ask questions, but remember, your doctor is doing this day in, day out. So if I see a bottom, it's no different to looking at an arm. I am listening to your history and I'm looking at that body part, looking for clues to give me the diagnosis. I'm not worried if you've shaved, if you've had a shower, I don't care. I just want to get to the bottom of what things are. And remember, 1 in 12 of my consults are gut related, so I'm looking at a lot of bottoms. I do a lot of women's health. I'm looking at a lot of vaginas and vulvas. I'm doing this all day. So take someone with you as well. That's another thing you can do.
I mean, this makes me feel better, because I once had to have an examination, and like a doctor literally had to put her hands up my bum, and then I saw her the next day somewhere completely out of context at some kids' activity thing, and I was just like, oh my God, and I felt so embarrassed, and I don't think she cared at all.
She probably doesn't, not being funny, she probably doesn't even, she's so impatient. She's probably like, oh, have I seen you before? Actually, yes.
I think so. And I was there going, oh my God, she's gonna be like, that bum and that face, it's you.
My memory's good, it's not that good.
Okay. Oh my gosh. So I want to just talk to you now about breaking taboos in women's health, because I know that's something that you're really passionate about as well. Conversations around women's bodies, they definitely need to be louder, don't they?
100% need to be loud. Women's health has been ignored for years. All the research has been done in males, often white males. Only 2% of research goes into women's health research currently. So
that's crazy.
Need to be working harder, and things are starting to turn, but it's really slow. And we're seeing that in places and conditions like endometriosis. We're learning a lot more about that. We're hearing a lot more about the gynae cancers. We're hearing a lot more about maternity experiences, particularly in Black and Asian people, where they have a real discrepancy in the care that they're given. I mean, it's just mind-blowing. But yeah, we've got to keep championing, keep talking and doing what we're doing. I mean, I'm going to test you now. Tell me the 5 gynecological cancers.
Okay, so I was going to ask you, but let me see.
Ah!
Okay, so right, ovarian cancer,
Yep,
cervical cancer.
yep.
Um, I actually, oh my God, what are the other ones? Ovarian cancer,
Beginning with V.
vagina.
Vaginal cancer.
Okay, right.
And
So
then
that's 3, and
there's
then there's.
vulval cancer and endometrial womb cancer. Now, you're not
See,
alone.
I didn't know.
No, and you're not alone, because actually most people can only name 1 or 2 of these. And only 1 in 4, 1 in 5 can name all 4. So if we don't know what cancers and bits can get cancer, how do we know? How do we know what to check? And it's these things that I really, really want to get into schools and into a sort of PHSE curriculum, but not to scare people. This is not to scare and fearmonger and cause health anxiety. I want to sort of remove the embarrassment and go towards empowerment. So move the ease along, because actually, if you feel empowered as a woman, then you can advocate for yourself much better. And historically, back in Victorian times, women were often just sort of cast away, that you've got hysteria, you've got anxiety, everything, even if you had a physical problem, was hysteria. And that's where the word hysteria comes from.
Right.
And so what have we done to women? We've made them feel that actually it might all be in their head, that they won't be taken seriously, that they'll be gaslit, that they will not be believed. Why would you want to go to a healthcare professional if you feel like you won't be believed? Why? Because actually you feel bad enough as it is. But why are we normalising that? And I don't like the word suffering, but it is. Why are we normalising suffering? It's like the heavy period narrative. I had heavy periods growing up. Mum wasn't probably told what a heavy period was, my mum. I could talk to her about it, but she just thought if you leaked on the bed, you leaked on the bed, and that was part of your cycle. If I had pain, you took some painkillers. But then it started impacting me, and I started thinking about endometriosis as I became a doctor. And then it took me 3 years to have my first child. And then I had my bowel cancer surgery, and what did they say to me? Your bowel's covered in endometriosis. Did you know you have bad endometriosis?
Wow.
Oh my God. I was straight down getting a coil straight away, and I've had no problems since. But with my daughter now, I am talking periods all the time, and I have gone to her swim club, I've gone to their school to teach them what a heavy period is. Because if you don't know what a heavy period is, you'll think that's just normal for you. But if anything affects your quality of life, your ability to go to work, your ability to go to school, you're getting anemic, that's a heavy period.
This is so important to talk about this kind of stuff, because it is like a lot of these things are just shrouded in shame and secrecy, and it's insane the amount that you said is invested into women's health. The fact that we are actually giving birth to next generations, right? Excuse me, can we have some attention to our actual bodies, please? It's really like, it actually makes it quite angry, to be honest with you. So you know those the gynae cancers, right, that we talked about. Are they often difficult to detect, and why is that?
Yes, so particularly ovarian cancer. You know, March we just had Ovarian Cancer Awareness Month. The symptoms are vague. That's the problem, and they can mimic a lot of other things. So the acronym BEAT, so bloating is for B, so you feel persistently bloated, not just after food, all the time. And then eating is E, and that means that if you feel full really quickly or your appetite's gone, that can be a problem as well. A, appetite loss, and then T, your toileting changes. Your toilet changes, you want to go for a wee more, or find difficulty going for a wee, or you're going for a poo more. And sorry, A was for abdo pain, so tummy pains or pelvic pains. So I think, you know, those could be a number of things. And sometimes women get misdiagnosed as IBS because of it, but we need to be doing those tests. With a lot of the other gynae cancers, so for the vulva, it might be itching in your vulva that's persistent, a new mole, a new lesion on your vulva, discoloration. But you need to be putting a mirror down there to look. And how many people do you think check their vulvas?
Well, I don't think people do. And also, when you say that, you need to be checking with the mirror. A lot of people are like, oh my God, I'm not going to do that. Like, do you know what I
But
mean?
how will you look at your skin? And 4% of people check their vulvas regularly. So, vulval cancer, yes, it's a cancer as you get older, but these are still things you need to be aware of. And if you don't know what's normal, we go back to it. But bleeding, so for a lot of the other gynae cancers, it's all about bleeding patterns. So you have a period, but if you're bleeding in between periods, bleeding after sex, bleeding after menopause, discharge that's abnormal for you, you need to be getting checked. And we can do all the checks, and we can refer you, and you can get diagnosed early, because getting an earlier diagnosis for any cancer saves lives, and you have less invasive treatment.
Okay. You know, Anisha, there are a lot of people now, because of the rising rates of cancer, there is a certain anxiety about, like, oh my God, is this cancer? Is that cancer? Is that cancer? Now, we do need to know all this information that you've said.
Yeah.
We obviously need to take that on board. But where is that balance for people that you would like to see between being scared and anxious about all these things and feeling empowered?
Yeah, and I think you're right that it's a kind of grey line, isn't it, where that can tip for some people. And I do see much more health anxiety, interestingly, because of information online than I used to 10 years ago. And the problem with some of that information is that it's misinformation. So I think you need to be going to trusted sites, trusted clinicians who are actually working in the field right now, not people that used to be in the field, because things are evolving all the time. And what I want people to remember is this information is to empower you. So if you get those symptoms, you can go to a doctor and present yourself and describe your worries, so that the doctor can then do the necessary tests and investigations to either reassure you or diagnose another condition, because there are lots of other reasons you can get these symptoms, and you equally need to get treatment and a diagnosis for that, or get you onto a cancer pathway. But most of the symptoms and the things that I see when you come to us, most times, 9 times out of 10, it's not cancer. It's not cancer. But we must be getting checked.
Okay. And is there anything else that you want people to know about bowel cancer, the symptoms, or any of the gynae cancers that affect women?
So I really want people to take up screening invites for breast, cervical, bowel cancer. We have these wonderful systems in place in the UK. This is something NHS does brilliantly, is screening for cancer. It's evidence-based. For bowel cancer, you'll reduce your risk of dying by 25% through the bowel cancer screening programme, because they're detected. All screening programmes are to detect cancer when you have no symptoms. And the reason I'm emphasising this is people think, A, I'm not going to do it because I haven't got any symptoms, or B, they get the wrong test. They've got symptoms and think, I'll do my screening test. That's not for that. If you've got symptoms, you go to your doctor. Okay. And if you have a loved one at home who might be in the age bracket, so over 50 for breast cancer, over 50 and over for bowel cancer, and 25 and over for cervical cancer, you need to be just nudging them today. Text them, have you done your screening for whatever cancer? Because it will save lives, and it makes sure that we can get cancer hopefully at the earliest stages. Guess how many people don't turn up for cancer screening?
What is it? Like, is it 50% or something like that?
It's 1 in 3 people don't go, don't respond, don't turn up for their screening invite.
The bowel cancer screening, is that something that people are invited for as well, like cervical screening?
Yes, the national screening programme sends out letters and kits at home. So actually the bowel cancer screening test you can do in the privacy of your own home. So you get a little kit through the post. You literally, it's a stick, you need to just dip it in the poo. There's no sort of, massive amounts of faeces or poo you need to put in a pot. It's literally dip it in and put it back in the post. It's as simple as that. And I say to people, if it comes through the post, you put it by the toilet straight away. Don't put it off. Don't put it under the filing. Don't say, I'll do it later. Just do it. We all know what we like. I would probably forget about it if I didn't just do it there and then.
Okay.
But I think it's really important that we just, even my own father, my husband and I said, Dad, have you, when he was in the age groups, have you done your test? He's like, oh no, do I need to? I'm like, Dad, come on. But I think again, it's the health literacy and the understanding of the test. People need to understand why you're doing the test, and it's to try and catch cancer when there's no symptoms.
What is the age range then when people would get that test sent out to them?
So it's every 2 years from the age of 50 for bowel cancer screening.
Right.
Up to 74. They've lowered the threshold recently.
Okay.
And it's taken time because you need the manpower and infrastructure to deal with the positive tests. And if you have a positive test, only 1 in 10 of those will be a cancer. So don't worry if you get a positive test back.
Okay. Anisha, it's been so interesting speaking to you, and this is such like essential information, and I think that people are going to just take so much away from this conversation. So thank you so much for coming on and chatting to me, and thanks for what you're doing to raise awareness. Every day you're doing this on social media. So doctors get cancer too.
Doctors get cancer too. Yeah.
Okay, great.
Thank you.
Which everybody should follow. And finally, this is called the lifestyle prescription, and I do ask guests that, is there any lifestyle prescription that you would want to share with the listeners? It doesn't have to be related to bowel cancer. It can, of course, but something that has helped you in terms of health and well-being that you would want to recommend to people.
I think I'm going to prescribe fibre to all my patients.
Okay.
Fibre is not a sexy nutrient in social media. It's all about protein, carbs. But fibre to me is the sexiest ingredient, nutritional elements, because 96% of us aren't getting enough. But it's going to reduce your risk of diabetes, reduce your blood pressure, reduce your cholesterol, keep you fuller for longer.
Mm-hmm.
It's going to help your digestion, your gut microbiome, which we know is responsible for so many things, from your skin to your mental health. Obviously reduces your risk of bowel cancer. And I just think we need to be getting more of it, and you need to actually think about getting 30 grams a day. It's not something that falls from the tree. Because there's such an ultra-processed diet out there, we really need to be looking at the back of packets and stuff and adding these things in. I don't believe in diets, I believe in adding things in, making sure it's worth it.
Okay, thank you. That's so important. So it's not all about protein, it's about fiber as well. Thank you so much for watching and listening to this podcast. I'm sure that you have taken some great things away, and please do share this with other people as well, because it's definitely beneficial to all our health. Thank you so much, and join me again on the next one.